The honourable member for Calgary Edgemont.
Women's health care in Alberta is in crisis. Women with high-risk pregnancies cannot see a specialist until 30 weeks, putting both mothers and babies at serious risk. OBGYNs are overwhelmed with patients waiting 7 hours for emergency C-sections. Rural hospital closures are forcing pregnant women to travel hours for care, overwhelming major centres. Yet, as healthcare crisis unfolds, the Health Care Minister is busy firing a CEO who dared to investigate bloated contracts procurement awarded to UCP Friends. To the Minister, how many contracts are fast-tracked for the government's Friends while Alberta women were waiting in emergency rooms?
Yep. The Honourable Minister of Health.
Mr. Speaker, the member opposite needs to get her facts straight here, because, Mr. Speaker, we just announced the other day, a few weeks ago, that we are improving our midwife strategy because of the fact that it's difficult to get practitioners into our rural communities. We want to make sure that our rural and Indigenous communities have midwives available to them, Mr. Speaker. We need to make sure that every pregnant woman, every woman has health care. It's the reason why we added not just 10 million, but 20 million for research for women's health issues.
The honourable member for Calgary Edgemont.
Given that midwives do not perform C-sections and surgeries, and given that this minister has delayed for over 2 years implementing fee code changes that would directly improve women's access to essential health care services, changes endorsed by the Alberta Medical Association, and given, while the Alberta women wait for these basic improvements, this minister has been awarding private companies lucrative surgical contracts that are now being investigated by the Auditor General. And given that the former AHS CEO was fired just 2 days before she was scheduled to inform the AG about this scandal, to the minister, how many more Alberta women need to be facing a healthcare crisis before
the Honourable Minister of Health.
Mr. Speaker, as a woman who's had 7 children herself, I think I'm capable of understanding the issues that women face during pregnancy. Mr. Speaker, we are working very diligently to make sure that we improve services right across the province, particularly to our rural, remote, including Indigenous communities, where they say they have lack of services. Mr. Speaker, it's the reason why we're upgrading our midwifery program. In fact, Mr. Speaker, we have more midwives now than we've ever had, and we're going to continue to recruit more surgeons as well.
The honourable member.
Given that announcements aren't doctors, given that announcements aren't more OBGYNs and more surgical spaces, and given that hospitals across Alberta, from Lethbridge to Fort McMurray, need explicit ministerial approval to provide abortion services, and OBGYNs are restricted in the care that they can provide despite their qualifications, and given that communities have been waiting for these approvals while this government fast-tracks approvals for private surgical facilities, to the minister, is blocking access to essential women's health care just another way of justifying handing over our public system to the UCP's Friends?
The Honourable Minister of Health.
Mr. Speaker, there has been no change in providing services or abortion services for women in this province, Mr. Speaker. That continues to be provided through the chartered surgical facilities that have been providing them even during the members' opposite time. Mr. Speaker, there's been no change in that, but what we want to do is make sure that women's health issues first are researched and also understood better so that we can address them better. It's the reason why we added much more than the 10 million that was recommended that the Premier had promised in our campaign. We've actually got $20 million out there to do this research so we can address real issues in real time.